Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is cubital fossa. Okay, so let us start. So first of all, the introduction of cubital fossa. The cubital fossa is a triangular shaped depression. So it is shape is triangular. So what is the shape? Triangular. So the cubital fossa is a triangular shaped depression which is located between the forearm and the arm on the anterior surface of the elbow, and with the apex of the triangle pointing distally. It is known as the antecubital because it lies anteriorly to the elbow, and it is a space filled with different structures that makes up its content, and it has three boundaries or borders, and it also has a floor and a roof. So if you see the diagram, you can see here this is the cubital fossa. So cubital fossa, this is the diagram of cubital fossa. Now let's read it again. So cubital fossa is a triangular shaped depression which is located between the forearm and the arm. So location is between forearm and arm. And the to the anterior surface to the of the elbow with the apex of the triangle pointing distally, and it is known as the antecubital. Why this is named as antecubital? Because it lies anteriorly to the elbow, and it is a space filled with different structures that makes up its content, and it has three boundaries and or borders, and it also has a floor and a roof. So let us start. Now, boundaries and borders. First of all, we start from the apex. So apex is an imaginary line that directed downwards connecting the medial and the lateral boundaries. So what is the apex? Apex is an imaginary line which is directed downwards and connecting the medial and lateral boundaries. Now medially. Medially the lateral border of pronator laterally the medial border of the brachioradialis, and the base directing upwards, and it is represented by an imaginary line joining the front of two epicondyles of the humerus. Now the floor, formed by the brachialis and the supinator muscle, and the roof, that is formed by the skin and fascia of the arm and the forearm, and reinforced by the skin. Superficial fascia containing the median cubital vein, the lateral cutaneous nerve of the forearm, and the medial cutaneous of the forearm. Deep fascia bicipital aponeurosis, which is a sheet of tendon-like material that arises from the tendon of the biceps brachii, and the bicipital aponeurosis forms a partial protective covering to the median nerve, brachial artery, ulnar artery, and radial artery. So this is the diagram you can see also. So the apex, medially, laterally, the base and the floor we have discussed. Then we will come to the contents. What are the contents present in the cubital fossa? The cubital fossa contains 5 structures which from the medial to the lateral. Number 1 is medial nerve, then brachial artery, then brachial vein, then the tendon of biceps brachii, then the radial nerve. So what are the structures? First one is the median nerve, second one is the brachial artery, third one is the brachial vein, and fourth one is the tendon of the biceps brachii, and fifth one is the radial nerve. So let us discuss one by one. First of all, the median nerve. The median nerve leaves the cubital between the two heads of the pronator teres and it supplies to the majority of the flexor muscles in the forearm, and it runs distally in the arm on the lateral side of the brachial artery until it reaches the middle of the arm, and where it also crosses to the medial side and contacts the brachialis, and the median nerve descends into the cubital fossa where it lies deep to the bicipital aponeurosis and the median cubital vein. And the median nerve has no branches in the axilla or arm, but it does supply articular branches to the elbow joint. So this is the median nerve. So what is median nerve? Median nerve leaves the cubital between the two heads of the pronator teres, and it supplies the majority of the flexor muscles in the forearm, and it runs distally in the arm on the lateral side of the brachial artery until it reaches the middle of the arm where it crosses to the medial side and contacts the brachialis, and the median nerve descends into the cubital fossa where it lies deep to the bicipital aponeurosis and median cubital vein. And the median nerve has no branches in the axilla or arm, but it does supply articular branches of the elbow joint. So first one is complete. Then the second one, that is brachial artery. The brachial artery provides the main arterial supply to the arm and is the continuation of the axillary artery. The brachial artery usually divides at the apex of the cubital fossa into the radial and ulnar arteries, which supplies the forearm, and it lies between the biceps tendon and the median nerve. And the brachial artery may be felt pulsating the mid-humerus deep to the medial border of the biceps after moving the biceps laterally. So what is brachial artery? Brachial artery provides the main arterial supply to the arm and is the continuation of the axillary artery, and the brachial artery usually divides at the apex of the cubital fossa into the radial and ulnar arteries which supply the forearm, and it lies between the biceps tendon and the median nerve, and the brachial artery may be felt pulsating at the mid-humerus deep to the medial border of the biceps and moving the biceps laterally. Then the brachial vein. Two paired deep veins travel alongside both sides of the brachial artery and collectively called form the brachial vein. So what is brachial vein? The two paired deep veins travel alongside both sides of the brachial artery and collectively form the brachial vein. Then the tendons of the biceps brachii. A muscle of the anterior compartment of the arm, the biceps tendon runs through the cubital fossa and attaching to the radial tuberosity just distal to the neck of the radius. Then at number 5, the radial nerve. The radial nerve enters the arm posterior to the brachial artery, medial to the profunda brachii artery, and it then divides into the superficial and deep branches anterior to the lateral epicondyle. The radial nerve is in a deep groove, also known as radial groove, between the brachioradialis and brachialis to the level lateral epicondyle of the humerus, dividing into its superficial and deep branches, and one another branch superficially in the subcutaneous tissue overlying the cubital fossa at the median cubital vein lying anterior to the brachial artery, and the medial and the lateral cutaneous nerve of the forearm related to the basilic and cephalic veins. Now we can see the diagram of brachial artery, median nerve, brachius brachii, radial nerve, the pronator teres muscle, and ulnar artery, then radial artery, brachioradius muscle. You see all the diagram here clearly. Now the clinical relevance. First one is venipuncture. The area superficial to the cubital fossa is a common site used for the collection of venous blood specimens and blood transfusion. The basilic vein, median cubital vein, and cephalic vein are superficial veins that are frequently selected for venipuncture at the cubital fossa, and the median cubital vein connects the basilic and the cephalic veins, and it lies directly on the deep fascia, running diagonally from the cephalic vein of the forearm to the basilic vein of the arm, and it crosses the bicipital aponeurosis, which separates it from the underlying brachial artery and median nerve, and it provides protection to the latter because of its characteristics and visibility. It is easily accessible for the collection of the venous blood specimen, and it may also be used for the insertion of a peripherally inserted central catheter. Now, brachial pulse and the blood pressure. The brachial pulse can be palpated immediately medial to the biceps tendon and in the cubital fossa. Also, when measuring blood pressure manually, a stethoscope is placed over the cubital fossa to auscultate the brachial artery for cough sound. Then the third one is supracondylar humeral fracture. Supracondylar humeral fracture. So, supracondylar fracture are the most commonest type of the upper arm injury in case of children, and it is an injury to the humerus of or upper arm bones, and at its narrowest point just above the elbow. They are frequently caused by a fall on the outstretched elbow or a direct blow to the elbow, such as the median and the radial nerve. And the displaced fractured fragments may impinge and damage the contents of the cubital fossa, such as median and radial nerve. And direct damage or post-fracture swelling can cause interference to the blood supply of the forearm from the brachial artery, and the resulting ischemia can cause Hoffman's ischemic contracture. Then the last one, that is cubital tunnel syndrome. So, cubital tunnel syndrome is a peripheral nerve compression syndrome. It is an irritation or injury of the ulnar nerve in the cubital fossa at the elbow. So, this is our today's topic. Thank you so much for watching the entire video. If you have any query or any doubt, you can comment down in the comment section. And thank you so much for watching the entire video. Do like, share, and subscribe to my channel for supporting me and my channel. And thank you so much for watching.